Hey there everyone. So for this week's episode of Education, I got a question from one of you, and it was asking a very simple question on the surface, but it's one that I feel is never really covered if you're ever outpatient and inpatient, anything like that, and you do have to sort of delve deep into the classifications to find out the answer. So what is this question? Well, it is, what is the difference between anorexia and bulimia? Well, as I said, it's a very simple question, and I feel that it is one that should have been covered when you're first diagnosed, really, because it is pretty normal to want to know exactly what you've been diagnosed with. So let's just go all the way back to basics. Psychiatry, it's all about defining things and putting them into their nice little boxes. And psychiatrists love to do this. And if you look at criteria for diagnosing psychiatric illnesses, they've got very specific things. For example, let's just say generalized anxiety disorder. Now, this is something where you have greater than 6 months of persistent worrying in multiple locations, along with more or equal to 3 somatic symptoms. So you can see that there's 2 numbers, 6 months and 3 somatic symptoms, and you need to have those to get diagnosed with it. I know you can have like borderlines and things like that, but psychiatrists love to do these kinds of things, and the same is true for that of eating disorders. So what is the definition of anorexia? Well, anorexia is classified when you have a BMI less than 18.5. The normal BMI ranges from around 18.5 to around 26. So if you have less than 18.5, you're underweight and you can be classified as having anorexia. The other things that you need to have in order to be anorexic, you need to have a persistent fear of gaining weight, excessive measures to go around not gaining weight, refusal to maintain a body weight that is normal, those kinds of things. Whereas bulimia is slightly different, and in bulimia, you're not underweight in the definition. You can be either normal or even overweight. However, the fact of the matter is that you can still have a distorted body image. You can still feel bigger than you are, and there is this fear of gaining weight, so there are some similarities with that of anorexia. A lot of people know bulimia as the illness where you throw up after you eat a lot of food, and this is part of the definition. You need to have greater than 3 months of bi-weekly, that is, it happens twice a week, of cycles where you eat a lot of food and then subsequently elicit a compensatory behaviour, whether that be self-induced vomiting, diuretics, laxatives, excessive exercise. See, you don't need to vomit, you can perform excessive exercise, or you can even restrict. So long as you fit the definition where you are normal or overweight, you exhibit these cycles, you can be classified as having bulimia. Now, anorexia, a lot of people just know that as the illness where you just don't eat, which is kind of true considering that anorexia means lack of eating, and anorexia means neural not eating kind of thing. So anorexia, but there are 2 different types. There's restricting type, and then there's the binge purging type. So restricting, obvious, you're not eating a lot, and you're performing things like excessive exercise. Binge purging is where you can eat a lot of food and you then subsequently elicit a compensatory behaviour similar to that of bulimia. However, in anorexia, you need to be lower than 18.5 in the BMI. So there are these subtle differences that do make it different. However, you then go into the realms of EDNOS, which is eating disorder not otherwise specified, and it can have certain aspects of other things. And EDNOS is frequently underdiagnosed because many people just have many of the features of anorexia or many of the features of bulimia. And to be perfectly honest, the treatment doesn't really change. And this is the same for many psychiatric illnesses. As I've said, they like to put them in the little boxes, but at the end of the day, the majority of psychiatric illnesses are treated with things like therapy, drugs such as SSRIs, which are a very commonplace drug in that of psychiatry. And what matters is the type of therapy that you have, or the type of drug that you end up having to take. So yeah, eating disorders are similar to that. However, in anorexia, the treatment does differ from that of bulimia, and this is because you are underweight and therefore malnourished, and the first step is normally that you need to be stabilized, and this is stabilizing your weight. This is stabilizing your general internal chemistry, that is your electrolytes, so things like sodium, potassium, phosphate. Loads of different things need to be stabilized, and this can be done on an outpatient basis. However, if you're classified as unstable, whereby you are very, very ill and you won't be able to do this outside, I did a video on refeeding syndrome, and that is one of the things that can happen if you are unstable. So if you're unstable, you need to be hospitalized and then subsequently stabilized in an inpatient setting where things can be given through IVs, so things like vitamins that you need to stabilize your electrolytes, and just to have a close eye put on you just in case anything were to go awry. Now once you're stabilized, you can then get focused onto weight gain, psychotherapy, all the different kinds of therapies, and just all the other things that go along with recovery. In bulimia, it is slightly different because you are at a normal weight. However, because in bulimia you can vomit, your electrolytes can go a bit out of whack, and the classical thing is that of hypokalemia, that is a low potassium level. This is very, very common, and if you do go to an inpatient unit and you see someone come in who's very malnourished, you see that they're given bananas almost immediately, because bananas are rich in potassium and they taste better than having things put in through an IV. So there is an element of classification, but it's not to stabilize your weight, it's more to stabilize your internal chemistry. And then after that, the things like therapy can begin. And unlike anorexia, there's a slight difference whereby people with bulimia can benefit from SSRIs, that is serotonin selective reuptake inhibitors, and they're the common drug used to treat depression. Now, it's strange, but people with bulimia do benefit from SSRIs whether they're depressed or not. So there again lies a difference in terms of the treatment now. Okay, so for those of you who have stuck with me for this whole video, you're going to notice an immediate difference. I'm wearing different clothes, I'm in a different place, but I was just editing this video and I realised there was something that I missed out. And it's another difference between anorexia and bulimia, and it is that with anorexia it is described as ego-systonic, whereas that of bulimia is described as ego-dystonic. So what do these mean? Well, ego-systonic means that it is consistent with your own beliefs, and this is true for anorexia. So when you see someone with anorexia, they don't feel that anything is wrong. They feel that what they're doing is right, it is the norm for them. Whereas that of bulimia, ego-dystonic, it means it's inconsistent with their beliefs, their behaviours. And this is true because they tend to be quite embarrassed about their behaviours. They tend to try and conceal their behaviours out of that embarrassment. And for this reason, it means that people with bulimia are more easier to treat. And this is because they realise that something is wrong and they are trying to hide it already. So it is easier to actually start treatment for them. Whereas those with anorexia, they don't feel that anything is wrong. So they're a lot more resistant to making any changes whatsoever. And you see this a lot of the time. People with anorexia tend to have tubes put into them because they are refusing to eat. They're saying, what is wrong? What is wrong with what I'm doing? And this is just an inherent difference between the two illnesses. So yeah, with that, I'll give you back over to past Simon. So yeah, I mean, I hope this video has been helpful. That there are many differences, but equally there are very many similarities between the two illnesses, and it's really down to the weight that you are at, and the other features that I spoke to you about. So, I mean, I hope this video has been useful and it has educated you about the differences between anorexia and bulimia. And if you want to know anything else about the other kinds of eating disorders, because I'm aware that there are many, and it's very difficult to cover it in a video that should be under 10 minutes in length. But if you want me to cover anything else, please do let me know in the comments section below, or send me an email, or just send me a message on YouTube. So yeah, I'm happy to do whatever. So for now, I look forward to making more videos, and thanks for watching.